Hello, dear friends. Do you know how to confirm the presence of pregnancy? How can we know that a woman is pregnant? If you are interested in this topic, please watch this video. We will talk about pregnancy tests and you will learn about some pregnancy hormones. I'm Dr. Olena Berezovska and I'm welcoming you to my YouTube channel. Today I will talk about the very first days of pregnancy, as most women are eager to know if they are pregnant or not. Modern women begin the search for pregnancy with pregnancy tests. How accurate are these tests? Do they indicate pregnancy? Pregnancy tests appeared in 1928 thanks to two research scientists. One of them was a German doctor, Selmer Aschheim, and the other doctor, Bernard Zondek, was from Israel. Both doctors found ACG in the pregnant woman's urine. When the urine with ACG was injected into the female mouse, it turns out that it stimulates the growth of her ovaries. And this experiment could confirm the pregnancy of a woman as well. In other words, female ACG affected the body of mice. Unfortunately, mice were killed for this. This method was called the AZ test and was carried out for 5 days. It was popular in Europe and North America. It was used in hospitals until the 1960s. The error of the test was only 2%. Interestingly, mice, rats, and even rabbits were used almost until 1970s. This method was expensive, and there was always a problem of obtaining animals. But there were no other methods of confirming pregnancy, and this method was most often used in difficult cases, not regularly. In 1930, Georgina Jones discovered that ACG is produced by the placenta. Until that time, it was believed that the pituitary gland produces this hormone and it has nothing to do with the female reproductive organs. But it took almost 30 years to understand this process and put the new discoveries into practice. Since 1960s, the levels of ACG began to be determined in the blood due to the advent of new technologies. These tests were used most often in hospital settings because they were not cheap. In 1962, the first test for detecting ACG in urine appeared. In 1990, a pregnancy test was developed and it became the prototype of modern tests for the detection of ACG in urine. Pregnancy tests are not 100% sensitive because they rely on a specific level of a pregnancy hormone in the urine. The minimum level to which these tests are sensitive is between 25 to 2500 milli-international units per milliliter. Modern electronic tests are sensitive to 2550 milli-international units per milliliter. We are talking about pregnancy if the blood level of ACG is more than 25, and not just total ACG but beta ACG. ACG consists of two subunits, alpha and beta ones. The alpha subunit is a part of other hormones, FSH, LH. Therefore, we are not talking about the onset of pregnancy detecting the alpha ACG. The beta subunit can be found just during pregnancy. If the level of beta ACG is more than 25, we can talk about a possible pregnancy. We do not know what kind of pregnancy it is, uterine, ectopic, healthy, defective one, but we can say that conception and implantation took place and pregnancy appeared. When should pregnancy tests be done? The advertisement of such tests are very promising. It states that tests can detect pregnancy even before a missed period. Tests can show different dates, for example 2-3 weeks, which is incorrect because we use obstetric or gestational age, which does not correspond to pregnancy tests. Sometimes the term according to the test is called the embryonic age of pregnancy or age after conception. It is not exactly the right name. We use obstetric weeks, and we will talk about this in other videos. Also, all pregnancy tests are sold commercially and the quality is not guaranteed, we doctors are not opposed to this test, but we recommend using them if there is a 7-day delay in menstruation. Then the reliability of the test results will be higher. When people ask me which pregnancy tests are the best, I can't answer this question as all tests are commercial. There are many companies developing these tests, but the quality of such tests cannot be verified. Therefore, in practical medicine, such tests are not used. In obstetrics, there are diagnostic methods for determining pregnancy. Can tests be false positive or false negative? False positive tests are more common than false negative ones. This is due to several factors. For example, before menstruation, the level of luteotropic hormone increases. Because of this, tests can be questionable or false positive. I'm often asked how to interpret the test results when they are questionable. For example, one strap is visible while the other is barely noticeable or absent. In medicine, it's still a negative test. In such cases, testing should be repeated after 3-4 days or a week. Doubtful tests in medicine are not perceived as positive ones. A woman cannot be a little pregnant. She is either pregnant or not pregnant. Pregnancy must be confirmed. We don't guess, we determine. False positive tests are more common in women who work with animals, such as at farms, zoos, and veterinary clinics. This is because in these women, non-specific antibodies may be elevated, which can lead to the antibody reaction with some test ingredients. Those women who have a lot of animals in the house can also have false positive tests. False negative tests are very rare, mainly due to the poor quality of the test. Also, if a woman tests too early, she may get a false negative result due to low ECG level. ECG can appear not only during pregnancy, but in the presence of certain hormonal tumors of the ovaries, liver, in the presence of chorioepithelioma, a very dangerous tumor. Therefore, if we cannot confirm pregnancy with a positive ECG level, we must take this seriously and find out the source of the hormone. There are other methods to diagnose pregnancy, and I will talk about them in other videos. If you like this video, please press like and subscribe to my video channel. See you soon!